Welcome to this special edition of Buncombe Life on heart health. I'm so excited for you to see this edition. It is a little longer than we normally do, so please sit back and get relaxed because I want you to see the whole thing. You might wonder, why would we spend so much time on heart health? It's simple. Heart health can save your life and it can improve the quality of your life, and every single one of us needs to know how to keep our hearts healthy. We want to thank Mission Hospital for helping us with this edition. They were great, and you'll see how they've really helped us. You're going to hear how serious and innovative Mission is and how lucky we are to have them, one of the top cardiac hospitals in the country here. You're going to hear how Buncombe EMS is training. They have state-of-the-art techniques that they're learning. Just so lucky to have them here. And you're also going to hear from some other people, and we're going to start off with two of those folks. Two individuals who've experienced some heart trouble. One of them is a county employee who works for us now, and the other one is somebody near and dear to my heart. So stay tuned and let's watch.
The only thing that I felt was like tired for like the month of July and August. Just felt run down. From like 2 o'clock on at work and at home, I just didn't feel like doing anything. And I just figured that was because it was so hot, you know, in July and August, that and the restless leg, I couldn't sleep at night. I'd lay down and I just couldn't get my legs comfortable. And I'd take a pillow and try to put it in different positions to get comfortable, and it just wasn't happening. Come into work, felt fine. Went uptown to do a work order, and started feeling real pain in my right elbow, and it went from my right elbow to my back. Just it felt like a lightning storm in my back. You know, real bad pain. Then it went straight to my chest. Just felt shortness of breath, started sweating real bad, and I told Russell, I said, you've got to take me to the hospital. I'm not feeling good.
So I asked him, you want me to take you to the emergency room? A few minutes, I asked him again. He said, yeah, let's go. So we started toward the hospital, and he said he felt like he was getting sick. So when he got situated in the seat, he said his left arm went numb. So I was trying to hurry through the traffic and everything, and all of a sudden he went limp like a dish rag. So I just grabbed him and held him in the seat and kept going.
Yeah, I had no clue that it was my heart.
I just had that feeling of like I haven't had anything to eat, and I was kind of shaky. Felt kind of dizzy a little bit, and got in the car and it went away. I guess it was on Sunday when we went to church. We were going up the spiral staircase. By the time I got to the top of it, I actually held on to the rail because I felt that dizziness again. Well, on Monday, which was the 16th, I went and finished up my taxes, and I went from the parking deck to the office and actually had to lean against the building. Had to hold on to the wall because everything was kind of spinning. And after I finished, that's when I said, I'm going to the doctor. The EKG, they did blood pressure, they did heart rate, everything, and everything was normal. And she said, well, Randy, you know, all we're seeing is about 15 seconds of your heart. So why don't we put a monitor on you and bring it back tomorrow, so that way we can see 24 hours worth of heart monitoring. So I said, okay. And she said, well, just go home, do your normal routine. And so I came back to the shop, I worked all day. I said, well, I'm going to give them something to look at. So I walked down to King Creek, and everything going down was fine. But it was on the way back, when I was walking up the drive. We've got a pretty steep driveway. As I was walking up the first hill, I noticed I was a bit out of breath. By the time we got to the top of our driveway, my chest was hurting and my left arm was hurting in 2 places. I remember walking up the steps to the front, walking in and walking into the kitchen going, we need to go to the hospital.
Well, when I got to the hospital, of course, Russell, you know, he's scared to death, and I could hear that he was talking to me, but I was slumped over in the truck seat, and anyway, he run inside real quick and said, you know, need someone out here real quick. They come out with a wheelchair, like they just poured me out of the truck, you know, into the wheelchair. You know, I couldn't couldn't even stand, you know, so weak and all that. But got me inside, and I wasn't up front there just maybe 10 minutes, and they had me on wheeling me back to have the operation.
Quickly, we got in the car, and we started down the driveway, and by the time we got down to Cane Creek, all the symptoms were gone. My heart didn't race. There was the pain in my arm, nothing. And I remember going, well, you know, I feel silly. And walking in and thinking, golly, this is a joke. You know, I don't have any symptoms. I don't have any problems. And walking up to that desk and going, hey, you know, this is what's going on. I had some chest pain. My arm was hurting. In a short period of time, they got to me. The nurse that pulled us aside and said, look, you know, everything here, we would normally send you home. But you said your arm was hurting, and that's not normal. So we'd like a cardiologist to look at you. I remember the cardiologist came in and gave us the options. They said, well, you know, the first thing we need to do is see if it's a heart issue, because there's like 150 things that can cause chest pain. And so they said the first thing I would do is get the treadmill test, the stress test. And everything happened exactly the same. My chest got tight, my arm hurt again. The doctor coming in and going, well, yep, you definitely failed it. There's a part of your heart that under stress isn't working right. So we need to do a heart catheterization. That's the next step, so we can actually see what's going on. And that's when he told us that, well, if you have a blockage, if we can open it with a stent, we'll do that. If you have more than one, we take you straight from the cath lab to the operating room and we do bypass surgery. And so if you're ready, we can do it now. And I'm like, just like, well, okay, I guess that's all right.
I had a stent put in. I was fully awake when they were doing it, and I could hear the doctor and the nurses and all that. The doctor's like, okay, I'm getting ready to go into your growing area, Mr. Chandler, and I'm going to go in and put a stent in. And done that, and immediately, as soon as he got the stent in and blowed the balloon up and the stent went in, immediate relief. You know, wasn't hurting in the chest no more. The elephant was gone off the chest, and felt real good. And I was in the hospital for 3 days and went home.
It was a really pleasant experience. So what seemed like about 20 minutes ended up being about an hour and a half, I guess. And I remember them coming in and telling us all about the things that we needed to do. They talked to me about heart path. They talked to me about changing my diet. They talked to me about exercise, and that I should look at it as a lifestyle change. And that was on the 18th. And on the 19th, I went home.
Oh, I feel 100% better. Yeah, can breathe better, starting to get a little bit more energy, still get run down a little bit in the evening times, you know, but I'm trying to walk every day, and they said even if it's 20 minutes a day, you know, and so that's it, just, it's you know, I'm changed.
After hearing about all the different things with Mission and heart path and all that's going on here, there was no better place in the Southeast to have a heart attack or have heart problem, and I didn't know that until all this happened.
Okay, did you enjoy that? That cute little guy you heard there at the end, that's my husband. He did have some heart issues like he told you about, and he said something there at the end that I wanted to repeat again. There's no better place in the Southeast to have heart issues than here because of Mission Hospital, and I can attest to that. When he came in that night and said, I think I need to go to the hospital, we're talking about a man who's never sick, about a man who thought he was completely the picture of health. And when we walked into that ER, I'll just say I was scared to death. They took care of us, they handled it, and as you can see, he came out the other side a much healthier and happier person because of the care that he got. So, next, we're going to go visit the Director of Cardiac Emergency at Mission Hospital, and he's going to tell us some of the things that they're doing, which are absolutely amazing. I am here with, and I'm going to let you introduce yourself.
Yes, my name is Frank Castelblanco. I'm Director of Cardiac Emergencies for Mission Health.
Okay, and you can understand how that feeds into what we're talking about here in this episode. Cardiac emergencies. We've talked to Glenn. You've heard from some others who've had cardiac emergencies, and you are firsthand, front line on what you see. So the first thing I want to talk about is, what do you see coming in here to Mission as cardiac emergencies? Are there a few? Are there a lot?
There's about 500 a year, at least, in terms of heart attacks of people coming into Mission, both locally from Buncombe County and from the region. So we are the center for Western North Carolina to take care of people who have any types of heart attacks, any kind of cardiac arrests, and any other cardiac emergencies.
Yeah. And when somebody at home, I know if I were watching this at home, I would say, well, a cardiac emergency. What is that?
Sure, it has a lot of different meanings. Basically anything heart related, so it could be a heart attack, it could be if your heart goes into a rhythm that's called an arrhythmia, which is very irregular and you get short of breath. It could be a cardiac arrest when your heart literally just stops and you collapse to the ground.
Yeah.
So a lot of different aspects we cover.
And those folks can come in here. I know we've talked to one fellow who was driven here. A lot of people, I think, try to drive themselves here, but they can also come here by ambulance.
They definitely need to, because our emergency department sees over 100,000 people a year. So if you call 911, they not only can activate the system and get all the doctors and nurses and technicians who would take care of you into the hospital as you're coming in, but they could also kind of bypass the system a little bit because they know what's going on. These paramedics are highly trained. They know how to diagnose heart attacks. They know how to help you if you're having a cardiac arrest, as well as lots of other emergencies.
That is key. I want to make sure that people have heard that. Over 100,000 people coming through the ER a year. That's a lot.
It is a lot.
So if you think, I think I'm having a heart issue of whatever kind, and you decide to drive yourself, number one, you may not make it, but two, you're going to feed into that
Sure.
system.
I mean, there's, you know, 10 people ahead of you sometimes. Yeah. It's very busy. And they're great at taking care of people. There's nurses in the waiting room so that if a patient comes in and they're in clear distress, they can triage them and get them to the back quickly. But you're right. A lot of people don't make it to the hospital because if you're having a heart attack, one of the major arteries in your heart is blocked. And that could lead to your heart literally stopping and going into a cardiac arrest or going into a rhythm where it's not pumping any blood. And we often hear of too many people who say, no, it's just indigestion, or no, can you just drive me? They don't make it. And so we want to try to avoid that.
Right, and I know we violated that. I know we've talked to Glenn who said he got driven here, that they violated that. I know when I brought my husband here with his episode, we drove here. Hindsight tells me might not have been a smart thing, but we were very lucky and we made it and we're very well taken care of quickly through the ER. However, when I hear you say we could have called 911 and they could have started the process, it's almost like a fast pass.
It is like a fast pass, if you would.
Yeah.
You know, because especially if it is something that's life or death, it's literally minutes. And so the biggest part, the first part, is understanding the signs and symptoms. Right. Obviously, the crushing chest pain, that's clear first and foremost, but men present differently than women do. And men will have that crushing chest pain where they have to grab their chest. And they may look pale, they may look diaphoretic, they may get nauseous, short of breath. There's all these symptoms. Sometimes you have pain in one or both of the arms.
Right.
Now, women can present with this, but they often don't, and that's the tricky part. Women's signs are a little bit different. Theirs may be shortness of breath only, or they may be back pain, or even fatigue, and that's the #1 differentiating symptom.
And we women are tired all the time anyway.
Sure, and honestly, women are too busy taking care of everyone in their family. They don't think of themselves. They're like, oh, it's just a little indigestion. I'm just going to sit down and it'll be okay.
That's right.
And as a result, more women ultimately do wind up dying. And that's something that we can help by just recognizing this and encouraging each other. If you're having these signs and symptoms, please call someone, call 911, let somebody know, because oftentimes we don't tell.
Right, and they've just waited. And some of those symptoms are they're not huge, and I know when Glenn told us that it did hit him all of a sudden, and he had all the symptoms, all of a sudden. But sometimes they come on just a little bit at a time.
They do, and your body will warn you.
Right.
And your body will warn you months ahead of time. You just have to pay attention to it sometimes.
Yep. Listen to your body.
Yeah, you definitely have to listen to your body. And then if you take it a step back, a little bit has to do with prevention. You know, in some cases, a lot of it has to do with prevention.
That's what I want to talk about, because we've seen these guys who fortunately have had the heart episodes. They've come through it. The mission has taken very good care of them and now have them in heart path. And what they're seeing is, I wish I had known and done these things before the episode.
Sure.
Do you see a lot of that?
We're trying to, you know, we're trying to set up systems, health screenings, get information out to people as much as we can so that they're aware of what to do.
They take it seriously.
Right, and understand that this is a life or death situation, and that unfortunately people are having heart attacks and other cardiac emergencies at a much younger age. We used to think, oh, I'm in my 70s or 80s, you know, maybe then I'll get a heart attack. We're seeing people in their 30s now, and that's a huge change that we don't like. That's something that's not good.
Now tell the folks at home what, we've been through it. I know my husband's been through it. I know exactly, I could track exactly what you were saying with the stent and the cath lab and all that is. Tell the folks at home, what is a stent and what is the cath lab?
Sure. So the cath lab is a specialized lab that literally is not an operating room, because they don't actually do surgery on the patient. But the way that they could get inside of their heart is by inserting a catheter into their femoral artery, so into that artery that's right by your hip there. They insert a catheter, goes all the way up to the top of your heart. They shoot a little bit of dye, and they see where that dye goes, and more importantly, where it doesn't go, because that part is blocked. So once they see where that is, that's exactly where they have to go in and fix. So they slide in another catheter with a balloon, and they inflate the balloon to basically compress that blockage, which is usually made up of that cholesterol that we were talking about.
Right.
So they compress that, and they slide in a metal stent. And a stent is like the spring of a pen. If you remember clicking, that's what it looks like. It's just like that, only much smaller, much more advanced. And they open it up, and it locks open. And so now your artery went from being 90 to 100% blocked to being fully open. And blood is going to the rest of that part of the heart that was blocked, and so that part of the heart is now saved. If we don't get the patient in time, if the patient waits and doesn't come in, and that part of the heart doesn't get that blood flow, then that part could die, and that's when you have a different quality of life, and that's when your heart function, your pumping power, they call it ejection fraction, is decreased.
Oh, and there's the heart damage.
Exactly, and that's what leads to a lot of different things, congestive heart failure, that you need oxygen, all those different aspects.
So that time factor is huge, getting you in here and getting that fixed. And I know you can do more than one stent. I know some people need more than one.
Sure.
If they get in there, and I thought this was a very interesting thing for folks who haven't been through it, if they get in there and they see that, okay, this is more serious than a stent, we've got to go in, they can open you right there.
They can. What they'll do is actually, so if you have blockages in several of the arteries and one stent or even a couple of stents can't fix it, what they do is they actually activate our cardiovascular surgeon team. And they will call them, and they will also come in 24/7, and so they'll start prepping the patient. That team gets here, and they do surgery because it is a life or death situation, and that's when you have the bypasses.
Yeah. Well, now all these things that we've talked about are great heart care issues. What is Mission's goal as far as heart care? I know you would rather not see a lot of people come here with the heart issues. You would like for them to be healthy and not ever have to see them. But what is your goal, long-term goal for Mission? I know you're one of the top heart hospitals.
We definitely are, and we're great at a lot of different things, you know, and I'm kind of bragging a little bit, but for where we are, in terms of Western North Carolina, we provide more services than most hospitals our size in different areas, because we specialize in every kind of heart care that you can think of, in all the new technologies. And you know, we have lots of different procedures that we do emergently that we would like to be able to have more focus on the prevention side of it. we're about 90% full most of the time in terms of our units. So there's a lot of heart emergencies that come here.
Wow.
So prevention is something that the hospital is very focused on. We want to make people healthier. And we want to do it in the right way. So we want to go out and teach people it's important to exercise, it's important to eat right, and know your numbers. In other words, know your cholesterol numbers, know your blood pressure, know your BMI, because lots of times those help us, and they help us to set goals. They help us to become aware, okay, maybe I do need to do this or do that in terms of medications or exercise or diet, whatever it is. And it's becoming aware. That's the initial part there that we really want to focus on.
Well, you might be able to stop an episode from even happening to you, and if not, at least you know it's a possibility. And then the beauty, I really do believe the beauty of mission is once they're fixed, you're not done with them. There's still education for what's happened to them, how to leave the hospital and do well, how to go into heart path so that you continue to work with that patient so that they have not only a good outcome for the next month, but for their lifetime.
Right, and that's what makes our program something that's nationally recognized. It's because we just don't focus on one aspect, but we want to make sure that they're not repeat frequent flyers, that they don't come back. We want to keep them healthy.
Right. Is there anything else you want to leave us with this morning?
Another program that we're working on right now with Buncombe County EMS and other EMS agencies is a program to actually take care of people who are having aortic dissections. And this is something that's very specialized.
Well, that sounds awful.
So your aorta is one of the major arteries that leaves your heart when you pump blood, and it sends blood everywhere. And what happens when an aorta dissects, the actual lining of it starts splitting apart. And if it were to fully rupture and open up, you literally have minutes to live because it's like springing a leak in a hose. Once you know that you have this and you kind of follow it, to have a system that can actually expedite the care so that paramedics say, hey, this patient could be having a dissection, and then regional emergency departments recognize this. We're setting up a system so that we can have our surgeons, whether it be vascular or our CV, our thoracic surgeons, come in and be ready to receive this patient because, like I said, it's minutes. And so it's important to set up a program that we shave off every little bit of time possible to save more people. More people actually die of this than die of heart attacks because it is so time specific.
Okay, I'll admit, Randy and I did not do what we should have done. We did not call 911 like you heard. You just heard Frank say, the quicker you get here, the better chance that you have of living. Well, we didn't do that exactly right. Don't make the mistake that we had. We had a great outcome, but we were blessed. Don't do it. Call 911. And next, we're going to visit the folks who will answer that 911 call, our EMS staff. They're amazing. Let's go visit. So what I want to talk to you about, Jamie, is y'all do a lot of special training with mission and on your own to be ready for all kind of events. But let's talk today about cardiac events.
Right.
So what do y'all do?
All our, actually every ambulance in Buncombe County is equipped with cardiac monitors that will be able to do 12 leads. And that gives us a picture of the heart. We can attach the electrodes to the chest, gives us a picture all the way around the heart. We can see what's going on, and we can identify the special patients that are having a heart attack, that are acute and need to be in the hospital right then. And all our paramedics are trained to interpret those and call those interpretations into the doctor and activate the cath lab. And then our intermediate level ambulances from the fire departments and the rescue squad are trained to acquire those and then read the interpretation to the hospital so they can activate.
So let's walk through this for the folks that are listening. So let's say that I think I'm at home and I think I might be, maybe, having a heart attack. We're going to talk about symptoms in just a minute, but if I think I might be, I should call 911.
Right. It's very important that you call 911. We are the first link in the chain of care. It actually starts with our dispatchers. Our dispatchers are trained to ask the questions to recognize a possible heart attack. They'll give you instructions, possibly to take aspirin if you're able to. That helps keep that clot as small as possible. And then they get the first responders from the fire departments and an ambulance to you as quickly as we can.
Okay.
And our goal is to get there within 9 minutes of the call. And we want to have that first 12-lead shot within 10 minutes of getting with you.
Wow, so within 9 minutes of the time I pick up and say 911, I think I've got a problem.
Right, that's our goal, to have an ambulance there is within 9 minutes. Our first responders are usually there within 4 to 5 minutes, and they start this care also. So it's very important that you don't drive yourself, you don't wait. If you think you may be having a heart attack, use the 911 system. That's why we're there.
Let's say the folks who've been watching this have seen heard from 2 folks who have had an event. They didn't call 911, they made that mistake, but they were saved, but they were having a blockage. So let's say they had called 911, you put those leads on them.
Right.
Would you guys have been able to tell there was a blockage?
Right. If it was what we call an ST segment elevation, MI, or heart attack, we're trying to look for those changes. Right. And so that is what the hospital is looking for, to take you directly to that cath lab, to bypass the ER sometimes, so you get that reperfusion quicker.
So not only can your guys see it here in the ambulance, you're sending it to Mission?
Well, we call our interpretations in. Our medics are trained to interpret it, look for the changes, know what those mean, and tell that to the receiving hospital, or to read the interpretation from the computer of the monitor, and then they'll make the decision based off of that. Right. As soon as we recognize it, we call the hospital. That gets their stuff going. They get the cath lab ready. We come through the ER. We show it to the doctor. He confirms it. And if they're ready, we go straight to the cath lab. And it's about 20 minutes faster coming in by an ambulance than it is if you drive yourself to the hospital to be reperfused. 20% of patients suffer a sudden cardiac arrest in the first 4 hours of chest pain. Wow. And so if you're driving yourself and that happens, there's nobody there to immediately start care. Right. That'll be delayed. With us, we have all the equipment, all the training to take care of you if something adverse happens while going to the hospital. So that's why it's really important you use the 911 system. Right.
And there's really no downside. Let's say that you're having the symptoms, you guys come, you check them out. You maybe don't see there's a heart attack. You're going to transport them anyway. They're going to be checked out.
Right.
It's a win-win.
Exactly. Now we can't rule out that you're out having a heart attack. We can just rule in that you definitely are having one. Right. But we still want to get you to that care. We'll still treat you the same if you're have changes or not. But we'll get you to the hospital, get you taken care of, and let the doctors do their job. But if you don't call us, go to the hospital, we can't get you that care that you need.
That's right. Now, how many of these kind of events do you guys see here in Buncombe County?
Buncombe County, approximately 20 to 25% of our calls are cardiac related, either chest pain, rhythm disturbances, cardiac arrests, things like that. So it represents a large number of our call volume, and a lot of our training is focused around cardiac care.
Right, and that's what we've heard in this segment. I've never been more proud to live in Buncombe County. And we've talked a little bit about special training that you guys go through. And I know there's some really special training you guys are getting ready to do. Tell me a little bit about that.
Right. One of the things we're looking at for the near future is progressing in what's called induced hypothermia or therapeutic hypothermia. This is the patients who have suffered a sudden cardiac arrest. We've done CPR, we've done defibrillation, but we've been able to get their heart restarted and get pulses back. And the studies show now that if we are able to cool a patient quickly after a return to circulation, that increases survival immensely. And so we're taking the steps to get more aggressive with our new protocols coming out in the beginning of 2013. And we'll hopefully be cooling more aggressively, doing cold saline, and starting the process to continue in the hospital and improve outcomes. Like
the saline really goes into your body.
Right, so just like the IV fluids you get when you're bleeding or you've been sick and you're throwing up a lot, it's the same stuff. We keep it in a cooler. Actually, it's a refrigerator, and we keep it about 33 degrees. And if we have a return of circulation, then we'll change over to the ice cold fluids and give those rapidly to start the cooling process, and the hospital will continue that, and then they'll hold them at a low temperature for about 24 to 48 hours. Then they'll start bringing them back up to a normal body temperature over several days.
That is awesome. If there was one thing, I just want to end with this, if there was one thing that you could tell folks at home that they need to be able to do, need to know about heart care, what would it be?
Probably first of all is see your doctors. You know, know the risk factors. If you're at risk for heart disease, that you're under doctor's care, and if you have signs and symptoms that you believe are related to your heart, that you call 911, that you use the system. That's why we're there, and we are that first link. And we start the care outside of the hospital, the same things they do, but we do it quicker, and it actually does make a difference in outcomes.
You really get a fast pass.
Yes. In some cases you do get a true actually not even a stop. It's just straight through.
Straight through. Awesome. You heard it here. You need to remember that. Stay tuned. Okay, now you know what to do. If you have those symptoms, who are you going to call? You're going to call 911. You've heard Glenn say it. You've heard Randy talk about it. You've heard Frank say it. Call 911. They will pick you up, take care of you, get you to the hospital. Mission Hospital will do their very best to fix you up. And then what? Okay, I have a fixed heart, but I'm still going to be eating the same way. I may not be exercising, or maybe I was in the wrong way. Who knows? I'm the same person. What do I do? Well, follow us and we'll show you. We've come here. You can see behind me, it looks like we're at a gym. We're not. We're a heart path. And I'm here with Mary Richard. I'm going to let you introduce your title and what you do here.
Okay, my name's Mary Richard, and I'm a registered nurse, and I'm the program director here at Heart Path.
Okay, and she's going to tell us all about what goes on here. And I know that if you're like me just a few months ago, you didn't know this existed. And then I've been introduced to it in a very personal way, which you've either heard about or are about to hear about. But Mary's going to tell us what it is. And that's the main thing I want the folks at home to know. What is Heart Path? And I know there's two different paths here, or probably more than that, but just tell us kind of an overview of what Heart Path is.
Okay, Heart Path started in Asheville area in 1983 at Mission Hospital, and it is a continuum type kind of program. We start at the inpatient hospital. The Heart Path staff that works there actually does discharge instructions or the pre-op instructions to get the patient ready for any procedure that they're having, whether it's a pacemaker, whether it's a cardiac catheterization, whether it's open heart surgery or valve surgery, and then they go ahead and go over the discharge instructions prior to them being discharged from the hospital. And then if they live locally, they actually are referred to our program.
Yeah, so they don't have to come here.
No.
But they're strongly urged.
They're always, and sometimes we have an order from a physician that says that they need to come to the Heart Path Cardiac Rehab Program after their cardiac event. If they live in the region, then our staff and the inpatient refers them to those closest, the cardiac rehab program closest to them, where they live. So once they come over here, we have, they have a telemetry program. Telemetry where they wear a box.
A heart monitor.
A heart monitor.
Okay.
Yes, a heart monitor. It's a telemetry box. And then we have a monitor tech that watches them while they're exercising. It's looking at their heart rate and their heart rhythm. We check blood pressures and ask them what their rate of perceived exertion, what their RPE is, because we want to know how are they feeling with that exercise.
Because let's say that you've had, and let's just use this as an example, a full-blown heart attack, and you've had surgery. I would think getting out and exercising would be a little scary.
It is, and a lot of it depends on how active they were prior to that cardiac event. If they're half marathon runners or whatever, I think they're a little bit more comfortable with what their body, because they've always listened to their body. If they've been very sedentary prior to their event, then it is a little bit more scary. But even those ones that run a marathon, they still question, how safe am I? Because it is scary to have that event.
I would think so.
And it does bring in a question about mortality. I may not have made it through. And so they do have those emotional issues that go along. It's not just physical, it's also emotional.
So you bring them first into Heart Path and they go into that
telemetry part of the program. And then after 12 weeks or whatever their insurance typically covers, once they graduate, then they can elect to either go to a home exercise program that they want to do on their own. They can go to a local gym, or they can elect to stay in HeartPath and go into the maintenance program. The one thing that we're different from a gym is that we are medically supervised. We have physicians that answer to any emergency up here. There is a medical director, Dr. William Wharton, who actually looks at the charts and signs off on all the charts, and is always every 30 days reviewing what's happening with the program with that specific patient.
And now I'm at HeartPath. I go 3 days a week. First thing in the morning, 6:30 to 8 o'clock. They put a heart monitor on me. And they got the computer over there, and it monitors all your vitals, your oxygen level, heart rate, and all that. Do 20 minutes on treadmill, 15 to 20 minutes on stationary bike. At the end of the last 20 minutes of the time, we do exercises with weights and relaxation and stretching and all that. Teach me about diet. The stuff that I used to do, I don't do anymore. You know, I never was a person to read labels or anything like that. And now I pick up everything I pick up. You know, I'm checking labels on the back of it, the sodium content and saturated fat and the sugar and all that. So, yeah, changed the whole way that I eat.
HeartPath, the thing that really is surprising to me, which I didn't think was going to be that way, was that they really care. That they pay attention to you. They want you to be healthy. They want you to be an example to others. They want you to be able to go out and do the things. I was really surprised that they told me when I started running to let them know, and they would actually come to the races and cheer me on. Which I'm like, that doesn't make sense, because nobody does that. And they have doctors and nurses and people who are specialists with heart and everything right there all the time. Before I went to the hospital, I weighed 191, and today I weigh 154. And it's really kind of funny because it all came off just really slow but steady. It was every 2 or 3 days I was losing a ½ pound to a pound and going to HeartPath, starting on the treadmill and working my way up to an elliptical. And so I do 40 minutes on an elliptical at a pretty high pace and a high rate. I do the Schwinn Aerodyne, and I lift weights.
Well, I'm doing 36 treatments, and they're saying that at the end of that treatment that I should be fine and be able to go back to normal living, you know, exercising and diet and all that, but they have a program where you can continue on. You don't have to stop at the 36 weeks. You can continue on as long as you want.
I didn't want to go on a diet, because a diet's something you go on and you go off of. So I felt like it would be better to just go ahead and change everything about the way I eat, exercise, just everything. So I cut out lots of things that I really like to eat a lot. Burgers and fries and hot dogs. Don't eat that stuff anymore. Eat a lot of chicken, whole grain, fruits and vegetables, pretty much it.
We're trying to take care of them. Right. We're not trying to be the Weight Watcher police and whatever, but if they're retaining fluid, we want to know that. Absolutely. If they've gained this big 5-pound weight gain, then we need to know why. Did you just eat at the Chinese restaurant this weekend, or are you retaining fluid? And so we need to know that. And the blood pressure, is it starting to climb? Because a lot of times after a cardiac event, especially in open heart surgery, they will take them off their blood pressure medicine and then watch and see if it's resolved or if it's climbing back up. And so that's one of the reasons why we check blood pressures, resting blood pressures.
Exercise is not the only thing that people, they've got some
emotional issues.
Some people have had stress issues that brought them in here.
Absolutely. And that's why we have a psychologist that's affiliated with, in fact, we have 2 psychologists that are affiliated with our program. What we do is we do psychosocial testing, quality of life, where are you now at the beginning of the program, and then where are you after, you've completed the 12 weeks. And then annually we do that as well, because we're always assessing you know, what is going on in your life? The psychologists actually conduct a class that talks about stress management, and then we have mini education classes, and there's a series of 3 that also talk about stress. And, you know, what can you do to relax or de-stress and those kind of issues. We have 2 dietitians, registered dietitians that work in our program as well, and they conduct mini education classes, but they're also available for any questions that come up. And one of the classes that they teach is on food labeling, and one's on dining out, you know, because we have a big population, especially as we get older. You don't really want to cook at home, so they teach them how to make healthier choices when they're eating out. So that's one of the other classes that they teach. And
that's awesome. And as they're going through the classes and having the stress management and learning how to properly exercise, if there's any episode, they've got you professionals here that can take care of that episode.
Right, all the nurses are ACLS, Advanced Cardiac Life Saving, and all the other staff are CPR, or the basic life, because they're now encouraged to exercise, they know how to do it safely. So it's a lifestyle change, plus it's a support system, and we haven't really touched on that yet, is that, you know, you're in exercising and in a class, because you're assigned a class that you've chosen the time that you want, with other people that have experienced cardiac events. So you have that comfort to know that everyone in this room that's exercising has been in your shoes at one point or another, has experienced the same stuff that you have, emotionally, physically, and they become friends. Their friends hold them accountable. Where were you on Wednesday when you didn't show up? Or, you know, where have you been the last week? And even the staff is holding them accountable, but even their peers are holding them accountable. So it's very good for them.
Well, and that is just complete care, because like we've heard, we don't want you to have a heart issue.
No.
You need to do it on the front end.
That's right.
But sometimes, you're going to have the issue anyway. Mission's going to fix you, take care of you, but then they're not going to drop you. They're going to bring you in here, and that is amazing.
And give you the tools to keep it going.
Yeah, it's important to know your numbers. It's important to
Absolutely.
know your body, to listen to your body, and then ask for help, because again, all this is available.
Right.
Amazing.
We're here.
That's right.
We're just trying to get the word out, so thank you for doing that.
Oh, you're welcome.
Okay, we have talked a lot about adult heart care, about adult heart health and cardiac care and what you should know. But believe it or not, it's not just an adult issue. It's a kid issue too. Now I have to admit, I wouldn't think that kids even need to think about this, but in today's world, they do. And we're going to take a trip to talk with Dr. Brad Friedman, who is going to tell us just exactly why they need to know their numbers just like we do.
I'm glad you're still with us, because I think this is going to be very interesting for you to hear. I'm here with Dr.
Brad Friedman.
Thank you. And you're a pediatric cardiologist?
That's correct.
Is that right?
Yep.
You know, I know there's a lot of issues dealing with heart issues in kids, but the one we want to focus on today is one I don't think hits anybody's horizon. They just don't really even think about it. That kids could have heart issues because of diet and things that could be prevented that drive them here. Tell me a little bit, let's talk a little bit about that. What do you see?
Well, you know, I think that it's a tremendous issue that you bring up, and a very important one. I think something that people don't realize is that kids that are born today are actually forecast to live a shorter lifespan than their parents.
With today's technology, that should be unheard of. That should not be the case. And this was really surprising when we started doing the piece that folks were watching. To hear this was one of the most surprising things that we learned. If I think of a heart issue, I think 50, 60, 70, yeah, that's when you start thinking about it.
Right.
Not so.
Right, and we're just starting to understand that, and the adults are way ahead of the pediatric knowledge base about this issue, but it's becoming more recognized. New guidelines are out about the importance of screening children for the risk factors that cause atherosclerosis or plaque in the arteries that lead to heart attacks in early life sometimes, in early adulthood. Those risk factors are high blood pressure, cholesterol problems, or what I like to call lipidology or dyslipidemia.
Okay, no, whoa.
Okay.
We got to talk about lipidology.
Right.
That sounds like the study of lipids, but what is that? What is that? What's a lipid?
Well, a lipid is basically a cholesterol particle. Yeah, and that's what everybody understands is cholesterol.
That's
what
the word
we're talking about.
Everybody, thank goodness now, is on everybody's radar is cholesterol. I think people know it's not good. You know, I need to keep it low. There's a number for adults.
Right.
But cholesterol and kids, you don't even think about that. That's something you shouldn't have to worry about. But you're saying there's a study of that, and you're a specialist in that. Tell us a little bit about that.
Yeah, I've studied an extra year or so in the study of cholesterol, and there's an exam that people take to prove that they're knowledgeable enough to treat people with cholesterol problems. And I've gone ahead and done that, and more people in pediatrics are getting into that and understanding that it's important. And I felt that was important because the guidelines now state that they want to screen every single kid, that every single kid between 9 and 11 years old should have their cholesterol checked.
Wow. And they're doing that.
Mm-hmm.
You're doing that. What are you finding?
Well, we're finding a couple of things. The primary reason for doing this is because we want to find that 1 out of every 50 to 500 kids who has a genetic problem with their cholesterol, which means that they have a genetic issue which makes their cholesterol level extremely high.
Hereditary.
Hereditary, that's right.
Okay.
So if we can find that in those kids and treat those children, we may save years and years, if not decades, off their life, treating them early for their cholesterol problems.
Right, well, I can say the 2 case studies that folks have been watching with this episode,
Right.
If you could have caught both of those guys, they both had hereditary cholesterol issues.
Right, right. And that's what we want to catch.
Right.
That's the primary thing. And the important thing to know about that is it doesn't have to be that somebody's overweight necessarily, or have other external factors that make it obvious that they're at risk. They could still have a major problem.
Because if kids are just eating the diet they watch on television, they're going to have cholesterol issues, even
Right.
probably if they're not hereditary issues. They're just from eating that stuff.
Right, and that's the second main population. We know about the obesity epidemic, and overweight epidemic in this country. Western North Carolina is certainly not immune to that. They're one of the worst, unfortunately. We're trying to get better with that. But the obesity problem affects children markedly more, actually, than adults, percentage-wise. The percentage of overweight and obese children is increasing faster than even our adult population. So with that come the problems of high blood pressure and cholesterol and diabetes and those types of things.
But if you can catch it there, you can stop it for a lifetime in many cases.
Absolutely. So that's why we preach early intervention and detection in addressing these problems as early as we can.
Now, 2 things I want to make sure that we cover. What is Mission doing along these lines? They've got you.
Right.
You're working here, so that's one of them.
Yeah.
We're attuned to it. We're attuned to it. That's a huge piece.
Right.
We're attuned to it.
Right. Yeah, so I guess the biggest thing that Mission's doing is bringing physicians with the knowledge base to deal with these issues and trying to educate the community at large, educate them, one, about the issues that it's there, and then also how to address it in a community sense.
Right, so they've seen it coming, and now they're addressing it. What do you do? What are some of the things that you tell folks to prevent, tell parents, you know, you've got a 9-year-old who
Right.
has high cholesterol. Oh my goodness.
Right, right.
What do you do?
So some of the major things are the first steps that we do or try to address diet and exercise. You know, lifestyle modifications. So try to eat healthier, avoid the sodas, the regular sodas, avoid the fatty foods. Don't go to fast food restaurants if you can help that. Don't get the French fries if you're going to the fast food restaurant. So that sort of thing. Try to modify diet, and then also increase exercise.
Get out and run around.
Get out and run around. We all know that's good for us, but it really does change our body chemistry and can change some of the blood pressure issues and then also the cholesterol.
So the things that we've heard for adults, it's for everybody.
Absolutely.
You don't wait till you're 25 to start looking at your cholesterol number.
No, not anymore.
Not anymore.
Not anymore. We're too smart for that now. We are seeing issues with obesity, though, that's not necessarily causing them to have cardiac bypass surgeries or open heart surgeries, but they're having to have orthopedic issues. They're having to wear, they can't sleep at night because of the obstruction of their airways. They have to take medications every day because of diabetes and other things.
And this is shortening that life that you talked about at the beginning, where you're seeing their lifespan's not as great, maybe even as their parents.
Absolutely.
For some of these issues.
Yep, and all of our technology and everything we can do and all of our knowledge, it won't translate into a healthier population unless we make lifestyle changes at the beginning and we use our knowledge to screen people that have genetic problems and find out issues and then address those issues early.
So would you think that parents that may be watching this and have a 9 to 11-year-old or a teenager, should they be screened for their cholesterol? Should they get their cholesterol checked? Because I think most people in their head don't think, I need to check that till maybe they're 35.
Right. If they wait till they're 35 and they have a genetic abnormality that causes them to have high cholesterol, they could have a heart attack by the time they're 35.
That's true.
Okay, so yes, absolutely, and it's not just coming from me. The American Academy of Pediatrics suggests this. All of the major cholesterol organizations suggest this, and it's a simple blood test. If we can add decades of people's lives and avoid procedures and heart catheterizations and open heart surgery by just figuring out which individuals have this issue, I think it's worth a little blood test.
Again, I need to know your numbers.
Okay. Yeah, that's right.
Every age.
It is important to know your numbers. How many times have you heard us say that in this episode? And how many times have you said, what numbers? What are they talking about? Well, we would never leave you hanging like that in an episode of Buncombe Life. So, we're going to go talk with Nurse Deanna, who is going to explain to you what the numbers are, why they're important, and why you need to know them and how you can improve them.
When people say know your numbers, we're talking about a couple of metrics that we look at to assess health. These aren't perfect, they're not a completely accurate description of health, but they include total cholesterol, which is comprised of high-density lipoprotein, HDL, low-density lipoprotein, LDL, triglycerides. We're also talking about body mass index, BMI, which is a ratio of your height to your weight. We're talking about blood pressure. We're talking about fasting blood sugar. Let's start with the total cholesterol for what the know your numbers mean. Total cholesterol is a measure of how fats act in your bloodstream. So cholesterol is another word for fat molecules, and they can be good and they can be bad. High-density lipoprotein is known as the good cholesterol. Its whole job is to package the nefarious fats in our bloodstream and ship them to the liver for processing. So the higher we can have an HDL number, the happier our heart will be. The low-density lipoprotein are the fats that plaster themselves to the walls, and you hear about things like atherosclerosis and hardening of the arteries, and that's the LDL fats. The triglycerides are a different kind of fat that we're still learning about that are partly influenced by genetics and partly influenced by lifestyle. They're sort of fats that your body doesn't know what to do with yet. So when we take in more than what we need, our body makes these triglycerides, and they're sort of loitering in our bloodstream, perhaps waiting to cause trouble, so we like to keep them low too. Another number we look at is the fasting blood sugar, and that is the number that we use for the amount of sugar that's in the blood serum in your bloodstream after you've not eaten for 10 to 12 hours. The blood sugar should be in a healthy range, meaning that your body is, for one, taking in what it needs, and that your body can handle what it is taking in and process it properly, making sure that cells get energy and making sure that it can get rid of excess. Blood pressure is a measure of the pressure that your veins exert on the blood that's coming through them. If you have a high blood pressure, that means the blood's having to work harder and your heart's working harder to get it through your veins. And then the body mass index is just a ratio of height to weight to maybe help determine if you're in a healthy range for your body size. So your numbers are important in terms of heart health for several reasons, but I just want to preface all of this by saying that biology needn't be destiny. So if you feel like your numbers should be okay and you get them run and you find out that they're sort of scary for you, that's okay. There are lots of points of intervention, and that's part of the beauty of knowing your numbers. However, things like high cholesterol, high triglycerides, high fasting blood sugar, and high blood pressure are really associated with cardiovascular risk. And what this looks like is, if you have high blood pressure, for example, it's really hard for your heart to push blood through all of your veins to get to all of the parts of your body. This fatigues the cardiac muscle, it ages it more quickly, it increases the likelihood of error because it's laboring so hard. It also increases the likelihood that you won't have adequate blood to all of your extremities, fingertips, toes, vital organs, things like that. Total cholesterol can be adverse for your cardiovascular health if it is too high, largely because of that LDL, that low density lipoprotein. The more of that stuff that we have circulating, the more likelihood there is that it will kind of plaster itself to the inside of our vasculature. That effectively narrows the arteries, increases our blood pressure, then we're back to our blood pressure problem again. There's also the likelihood that it can thrombose. It can become fatty globules that are floating around in our blood, and that can cause problems because our blood doesn't like globules. It needs to run smoothly. So triglycerides, a little unclear how those immediately affect cardiac health. There have been, though, studies showing that the higher your triglycerides, the higher cardiovascular risk you're at. With the body mass index, if you weigh too much for your frame, the simple part is if you weigh too much for your frame, then you're at higher risk for having a cardiovascular event, it's called. Could be a heart attack, could be a stroke, could be something like that. The BMI is sort of a special indicator, though, because it can be affected by your actual frame. It's not a 100% accurate reflection of everyone. That's why we look at so many different numbers and don't determine your cardiovascular risk based only on one.
If you have missed any of this episode, I hope that you will watch it again. Catch us on YouTube. You can find us on buncombecounty.org. It's just a really important episode full of information that I really think is important for all of us. It's certainly been important for me and my family. Every bit of this we have taken to heart, and it's changed my husband's life, it's changed my life for the better. The things that we really wanted you to get from this episode is to listen to your body, to call 911 if you think you have a problem, to know your numbers. And then, as always with the Buncombe Life episode, we want you to be proud of the county you live in. And we have given you multiple reasons this time to be proud of where you live. And one more time, let's thank Mission Hospital for helping us with this. As you saw, they helped us out, and they are an amazing partner here in this community. But I want to give the last word to our two special guests today.
If you're not listening to your body, that's a big key factor right there. I didn't listen to my body, and I had the heart attack. If you have feeling tired or anything like that, just doesn't feel normal, you need to go to your doctor and have it checked out. What else can I say? I'm here and I'm alive.
I always looked at my life as, well, I'm an average guy. The average lifespan of a male is about 72 to 74. Well, I'm 54, so that means I had 18 to 20 years left. And the last time I went to the doctor, he goes, but I don't see any reason why you couldn't live to age 90. I look at it from the standpoint that I've got a lot more to live for. I have a chance to live longer. I feel better. I'm moving and doing things that I never thought I would do. I think the biggest thing is just the outlook. I have this feeling now that, hey, I'm finally healthy. And in the back of my mind, I always wanted to be, but it always seemed too hard. But it's really not that hard.